start right away. I'm gonna do a couple of tests and then start the therapy. That way I get as much done in my 15 minutes as I can get done. I'll explain to you what I'm doing as I get started, but that way you'll get more out of the treatment time.
Okay.
All right, so at rest, point to where the pain is the worst for me. And on a scale of 1 to 10 at rest, what's your pain level?
At rest, it's 2 or 3.
Okay. Go ahead and put it through a range of motion that makes it feel worse. Go as far as you can before you say that's too far, and then give me that number.
Start to pull there.
Okay. Keep going if you can. That's as far as you can go. All right. What's that number?
It's probably about a 6.
Okay. Go ahead and relax. I'm gonna do one more thing. But where it hurts again? Here.
Right in here.
I'm gonna press. Does that make it worse too? No, no pressure. Just the motion.
Just the motion.
Okay. All right. Get my setting here. Choosing medium muscle, younger, low muscle mass. Okay, same area though. All right, so, oops. We need to have you put our fancy little goggles on. The reason for that, laser cannot harm anything. However, our eyes can focus light smaller, and that makes it stronger, and therefore it can potentially harm the eyes. So we just protect the eyes with the goggles.
Okay.
All right, so I'm going to put it directly against the skin. I'm going to use nice comfortable pressure. This should feel warm, but never uncomfortable. If it's either too warm or if there's a sharp pokey feeling, let me know right away. You feel the sharp pokey right away, so it's not going to happen.
Okay.
I'm going to treat up to 10 minutes in this one area. If the longer I treat, the more potential for warmth there is, so you keep me posted. It's up to you to tell me because I can't feel it.
Okay.
I'm going to go with lots of pressure and as slow as I can go, because I don't want it to warm up. I'm going to go super slow because that makes the light go deeper. All right, so do you know what we're doing at all? Have you ever heard of laser therapy?
No.
So what laser therapy does is reduces inflammation, increases circulation, and removes the roadblocks that stop the cells from healing properly. So things like this, how long have you had this?
Oh, a couple months, 3 months.
So it's a chronic condition. It's not going away on its own, right?
Right.
So when you apply light, it actually removes the roadblocks to healing and allows the chronic stuck state to start moving back through an acute phase, and we can heal further than it did the first time by removing the roadblocks. It typically takes us 2 to 3 weeks to get the best outcomes.
Okay.
Although today you'll feel significantly better in that 15-minute session. My goal is for your pain to be less than 1 before I finish. That may or may not last. It could last 2 hours, 2 weeks. I don't know. It's different for every person and depends on what causes it. But in the course of 2 to 3 weeks, we treat whatever part of the body is contributing to the pain. Because what I mean by that is that when I'm treating here, when I get this part that I'm treating, this very small area, down to a 1 or less, you're going to feel pain somewhere else. It's not that it's new pain. It's that this dominant pain is gone, so now you're noticing the less dominant pain.
Okay.
And we use those signals that the body gives us to chase it around and treat all those affecting conditions, which is also why I point it. So let's say you come in on day 2, 3, or 4, whatever it is, this pain is completely gone, your shoulder's better. I'm still going to check other areas by pressing, because it shouldn't hurt to press.
Okay.
It's not normal. So I'll treat all the areas that pain are either is aggravated by motion or by pressure.
Okay.
And so that's why it's a process of 2 to 3 weeks. We peel the layers back, and over that course of 2 to 3 weeks, we get long, sustaining outcomes. And it's significant, frankly. The best treatment course is 2 days in a row, 3 if we can. So tomorrow's Friday, so 2 days in a row would be ideal. So at the end of this session, if you decide it's something that you want to do, we need to see you tomorrow.
Okay.
Make sense?
Yep.
All right, so I'm going to test it now because we're 2.5 minutes in. At rest, what's your pain?
2.
Okay, still 2. Go ahead and do the range again. What's your pain now?
Yeah, it's better. It's higher. It's like,
less.
yeah, it is.
And you're moving higher.
Yeah.
So that was only 2.5 minutes. I've got up to 10 in one spot, so let's keep going because I'm not less than 1, right?
Okay, right.
Okay, so if it was less than 1, I would stop and I would pick a new area because I want to get to 1 or less is actually not less than 1 or less. If I go too long, I can lose the benefit. If I don't go long enough, I don't get enough benefit.
Okay.
So that's why it's really important for you to give me feedback as to just the area that I'm treating.
Okay.
Even if you feel it somewhere else, I don't want to know about that just yet. I'm just tracking the area that I'm treating.
Okay.
Okay? And oftentimes that first session, it feels better. The second session is kind of breakthrough.
Okay.
It feels better.
Okay.
Are you okay with us using these for training?
Sure.
I'm going to ask you on camera. It's better for everybody. We've got about a minute left. But I'm actually going to test it now because you did improve pretty quickly in that first. So at rest, what's your pain?
Oh, at rest, it's like 2.
Is it
It's
still?
minimal. 1. I
My
don't feel
question
any
is-
pain right here.
Okay, so one, it's less than 1 then?
Yes.
Okay, do the range of motion. Go as far as you can. That's a lot better range.
It is.
Okay, what's your
It
pain
is.
level now?
A 2. I mean, there's a little bit of pulling yet,
Okay,
But-
pulling but not pain.
but not pain.
Where's the pulling?
Right in here.
Lower, so it's actually not the area we treated. So we're done here because it's less than 1 in the area we treated.
Okay.
Now go ahead and relax. I'll treat this area next. How about that? And by the way, this is very common in the shoulder. It starts here, it can go all the way down the inner arm, it could be back here, it could be here, it could be on your trap area. That's why we chase it around, and that's why it takes 2 to 3 weeks. All right, so a couple more points. Very rarely, but occasionally, after your treatment, you feel good for a couple of hours, and then it can kind of get achy again.
Okay.
And once in a blue moon, it can actually hurt. That's actually a chronic condition moving back through that acute phase. It's good. It's part of the healing process. It just feels uncomfortable.
Okay.
So I warn everybody, just in case you experience it, it won't alarm you.
Okay.
If it happens, you put some ice on it for 5 minutes, every 30 minutes as needed. A bag of peas is perfect because it molds around the area
Okay.
perfectly. Just as much as you want. You can do Tylenol or Advil if you want to. I'd rather you not because they actually slow the healing process. This will continue to work in a positive direction for up to 24 hours, which is why we like to see you on the second day, right? So do your normal activities. Don't show people your improvement. Tell them, or show them with a good arm.
Okay.
I was here and I went to here,
No,
kind of thing,
no,
right?
no.
Okay. Go ahead and give me a at rest right here.
At rest, I feel no
Okay.
pain.
Do the range again. Go as far as you can go, and point to where it hurts. A lot better range. Is it still uncomfortable here?
Geez, it's great. Maybe just a little bit higher.
Just
there.
a little bit right here. So for the camera, our treatment area is the size of the palm of your hand or the 2 middle fingers from the tip of your fingers to your wrist. So approximately 2 by 7 or 3 by 5. Light scatters 30 degrees in every direction inside the tissue, so it gets wider as it goes deeper in. And so it's the warmest you'll ever feel it is on the surface of the skin. There's no risk to the inside tissue. Now, instantly you're going out, I want you to go forward and do this for me and see if you can isolate anything else as well. Because in a condition like this, again for the camera, there's multiple areas that are affecting the condition. And we want to get as much done as we can a day per 15-minute treatment. We treat in 15-minute increments. We, again, ideally do 2 days in a row, and then 3 if we can, but tomorrow's Friday, so 2 days in a row. So if this is something you decide you want to do, it's going to be a 3-week course of care. Every other 2 days in a row, maybe 3, and then every other day for 3 weeks. If you come in 2 days in a row without pain, we're done. And if you have 2 sessions left in the bank, you use them for what we call maintenance. Because if this is gone and done and healed, it's over.
Okay.
If there's something that's mechanical that's causing it, like a pinched nerve or a disc in the front neck or something like that, or a torn rotator cuff, it will slowly start to creep back. So if it creeps back, you use those sessions when the pain is low, it keeps it low. It doesn't get bad again. If you let it get blown out again, you start over at 3 weeks. Does that make sense? All right, we got 2.5 minutes. Let's test that one more time. Give me a good full range. And go as far as you can go. That was much smoother.
It is.
Did you see that difference in the way she moved?
It is.
Yeah. Okay, go forward for me.
Now this part hasn't bothered me.
Okay.
It's like
How about this?
and then
Okay.
that has hurt in the past. Now there's tightness there, but there isn't pain.
No pain. Yay! That's what I wanted to hear. So, we did 5 minutes and then 2.5 minutes. So we're 7.5 minutes in. I can do. Where's the tightness that you feel?
Right here.
Right in this area.
Mhm.
So let's take my last 2.5 minutes and let's treat there. Process and unstick it.
So it's okay that I would come back for another treatment tomorrow within
Ideally.
that 24 hours. So
Yes. Yes.
Okay.
Yeah. Yeah.
I think you're only open to-
You can actually technically treat 2 times a day,
Oh,
but it doesn't. It's not very convenient for a practice setting. If you were brand new injury, I'd encourage that, but since it's chronic, it's not gonna go any faster with 2 times a day.
Okay.
One more range of motion for the camera. Go as high as you can go for me. Oh my heavens.
Wow.
Yay, go backwards. Perfect. All right, we're done. Thank you. Any questions for us?
No?
Awesome.